morning. I want to welcome you to our Friday press briefing with updates on COVID-19. Please join me in a moment of silence for the lives we've lost from COVID-19. Thank you. Now we'll hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
We received positive reports during the weekly meeting of the task force on Wednesday. There were only 25 COVID patients in the 2 local hospitals, which is the lowest number since the first week of November. The positivity rate fell below 5% for the first time since December. The 14-day rate fell below 100 per 100,000 population for the first time since December 2nd. While this means the city can no longer enforce the mask ordinance under the terms of the governor's executive order, everyone is required to wear a mask or face covering when in a federal building or a building owned by the city. There is, in any event, no legitimate reason for anyone refusing to wear a mask in public. I would take this opportunity to provide information regarding the vaccine rollout. An article in this morning's Herald reports that 1 in 10 Americans have been fully vaccinated. Governor Kemp recently announced that over 60% of Georgia's senior citizens have received at least 1 dose. The vaccine has been available to those who are 65 and older, healthcare workers, and first responders since December. We previously mentioned that Johnson & Johnson obtained emergency approval of the vaccine it had developed. This is a 1-dose vaccine, which means the individual is fully vaccinated once the first shot is administered. The Department of Public Health recently received a shipment of the Johnson & Johnson vaccine. The original tiered phasing of vaccinations has been shelved as the production of the 3 vaccines has accelerated. Teachers, school employees, adults with intellectual disabilities, and parents of children with complex medical conditions became eligible for the vaccine on Monday. Governor Kemp earlier this week announced a second expansion, which will take effect next Monday. This includes those who are 55 and older and others with high-risk medical conditions, which includes asthma, cardiovascular disease, diabetes, hypertension, and obesity. We are fortunate that the state selected Albany as one of the 5 original mass vaccination sites. That location has the capacity to inoculate hundreds of people each day. Additionally, medical practices such as Albany Internal Medicine and pharmacies are now authorized to administer the vaccine. President Biden has challenged the governors of all 50 states to make the vaccine available to all adults by May 1st. This is much sooner than was previously anticipated. The federal government in recent weeks has increased the quantity of Pfizer and Moderna vaccines being delivered to the states. The federal government on Wednesday ordered 100 million doses of the Johnson & Johnson vaccine. We are now confronted with a unique challenge. In the coming weeks, there will be sufficient vaccine for all adults in Dougherty County. There is, in our community and throughout the nation, vaccine hesitancy, which refers to a reluctance to be vaccinated due to concerns that there may be side effects, including long-term health problems. The medical community assures us that there is no basis to support the rumors which have made millions of Americans disinclined to be vaccinated. Most people have nothing more than temporary pain in the area of the arm where the vaccine is injected. Some people experience headaches, nausea, and fatigue, but only for a day or 2. I have been surprised by the number of eligible citizens who have not been vaccinated. We must persuade those who are reluctant to be inoculated. This is particularly true for the elderly and vulnerable, as these citizens are more likely to be seriously ill and die if infected. Nationally, African Americans and Hispanics are being vaccinated at much lower rates than whites. We have created public service announcements to encourage all our citizens to be vaccinated. I would ask that those of you who are reluctant to be inoculated or have reservations consult a physician who will be in a position to answer your questions and address any concerns you may have. Please understand, those who are not vaccinated will continue to be at risk of infection. In closing, we should remember that citizens continue to be infected each day, and that some of those who will become so ill that they will be placed on ventilators and will struggle for their lives. Each of us should continue to follow the safety precautions, wear a mask, watch your distance, wash your hands, and avoid large gatherings. Thank you.
Today, Chairman Cohilas is not with us today, but we are joined by the Chief Judge of the Dougherty Judicial Circuit, Chief Judge Willie Lockett. Would like to bring you up for some comments. Chief Judge.
Thank you, Chief, and thank you, Mayor. Thank you for this time. As you know, due to the COVID-19 pandemic, our courts have not conducted any jury trials in over a year. Last December, we adopted a comprehensive plan to resume jury trials safely in January 2021. But there was a dangerous surge of COVID-19 cases during the holidays, and our Supreme Court suspended jury trials statewide again. The surge, as the Mayor has pointed out, has recently declined. There's a dip in the number of new cases and, thankfully, deaths caused by COVID-19. And so Chief Justice Melton has again given us the green light to begin holding jury trials again. The comprehensive jury trial plan that we adopted in December includes all of the safety precautions, the best practices, and protocols that have been recommended by the Centers for Disease Control, Georgia Public Health, and the Georgia Supreme Court COVID-19 Task Force. While we celebrate the decline in COVID-19 cases and deaths, when we resume jury trials, we will continue to strictly enforce every part of our jury trial plan in Dougherty County. In other words, we are not lifting any of the best practices and restrictions that are contained in our plan for preventing the spread of the virus. Specifically, before entering the judicial building, everyone will still have to answer screening questions about whether they have recently been exposed to COVID-19 through someone who lives in their household or elsewhere, and whether they're experiencing any COVID-19 symptoms. If they answer yes, they will simply not be allowed to enter. Every person must also have their temperature checked before entering to make sure that it is normal. Everyone must wear a mask or face covering over their nose and mouth at all times in the judicial building. Everyone must follow the directional arrows in the floor to avoid congestion in the hallways and other areas. Social distancing of at least 6 feet must be maintained at all times throughout the building, including in the hallways, the stairs, the elevators, and all waiting areas. Signs have been posted throughout the building to advise everyone of the number of persons at any given time that will be allowed on the elevators, in the restrooms, the stairways, the waiting areas, all to maintain proper distancing. Sanitizer dispensers are installed throughout the judicial building, and signs are posted to remind and encourage everyone to sanitize and wash their hands frequently. Public water fountains have been closed off, and persons who eat or drink while in the building are directed not to share cups, eating utensils, napkins, or other such items. All courtrooms and the jury assembly room have been configured so that everyone will be properly distanced during jury selection, trials, and jury deliberations. Seating has been clearly marked so persons will know where they are allowed to sit and where they are not. Each courtroom is also equipped with plexiglass protective shields, similar to the ones in this meeting room, and they separate the lawyers, the judges, the clients, the witnesses, court reporters, bailiffs, and others who are in the courtroom. Whenever allowed by law or agreed to by the parties, witnesses may testify remotely by video conference rather than appear in person to testify. During trials, the judges may allow witnesses to remove their masks temporarily when they testify, so that person will be guaranteed their right of confrontation. But they must wear a face shield and remain behind the protective plexiglass shields in the witness stands. Jurors will view physical and documentary evidence by video whenever possible. When video is not possible, each juror and each attorney or witness will wear gloves when handling evidence. Grand juries in Dougherty County will resume on March 24th. Jury trials will resume April 6th for state court and April 12th for state and superior court. Summonses have already gone out for those particular sessions, and jurors who have received those summonses have in large part responded by returning their questionnaires and been qualified to serve. Anyone who has received a summons and has not done so should do so immediately. And if anyone has any questions about the jury trial sessions or about their jury service, they should call the jury assembly room at area code 229-878-3187. That's 878-3187. As we have done in the past, we will continue to conduct non-jury hearings and proceedings remotely by video using Zoom and WebEx and other available technologies. Again, I appreciate the opportunity to be here. I want to assure all of our citizens that although we're happy about the surge declining, we're still out of an abundance of caution. When we hold jury trials again, we're not relaxing any of the detailed measures or lifting any of the restrictions that we have put in place to protect the health and safety of all our citizens as we move forward in our quest to safely provide justice for all. Thank you. I'll remain around in case there are any questions.
Thank you, Chief Judge, for your update today. We will now move to an update from Phoebe Putney Memorial Hospital. Dr. Kathy Hudson, the Chief Medical Officer for Phoebe Putney Memorial Hospital, is here to provide an update.
Thank you very much. As of this morning, Phoebe is caring for 37 COVID patients in our hospitals. There are 32 here in Albany and 5 in Americus. Now, this number is slightly increased from what we had yesterday, but overall it's a significant decrease in the right direction. Wednesday marked our anniversary of the day we found out about our first COVID-19 patient here in Albany. We held a day of remembrance at our hospitals across the area. This included tribute walks and ceremonies, and I'd like to thank Mayor Dora and Chairman Kohelis for participating in our ceremony here in Albany at the main campus. We also hosted community drive-through luminaries and light shows at all of our campuses. And I appreciate everyone that participated in the events and showed their support. You know, we could not have accomplished what we have done here at Phoebe and in Albany without the unity and support of this community. I know we all look forward to a day that we can put COVID-19 behind us, but it's not quite there yet. I really believe that if everyone would get their vaccines, continue to wear a mask a little longer and social distance, we can put this behind us. But it's going to take us all working together. As of yesterday, we had administered over 37,000 vaccines. We're well stocked with vaccines. I know at one time we did have some trouble with supply, but now we are well stocked, and we can accommodate the new expansion that was announced by Governor Kemp this week. He has expanded the group to include individuals 55 years of age or older, or 16 or older with chronic health conditions such as asthma, cancer, heart disease, diabetes, hypertension, sickle cell, and there are many more that can be looked up on the website. In other words, the vast majority of Georgians could qualify for the vaccine at this time. And so I strongly encourage that everyone, if you haven't been vaccinated, you've been hesitant, reach out to your primary care physician and discuss it, because we really need everyone to be vaccinated. That's the only way we're going to beat this pandemic. So if you want to go to Phoebe, you can reach out to 229-312-1919. Scheduled vaccine. Again, we have ample supplies. You can also go to the state mass vaccination site in South Albany near the airport, and you can go to myvaccinegeorgia.com to schedule with that site. AAPHC also has vaccination sites, Albany Internal Medicine, so we have multiple options for vaccinations in this community. So again, as of Monday, the vast majority of our individuals will be qualified to get the vaccine, and I strongly encourage everyone to be vaccinated. Again, I've been vaccinated the first day that we offered it here in Albany. I had a little soreness in my arm. I had my second vaccine 21 days later. I had a little soreness in my arm. There are some individuals that have some side effects. They may run a fever, some body aches, but it is so much better than coming down with COVID-19, because that can be devastating. So, thank you.
Thank you, Dr. Hudson, for your update from Phoebe Putnam Memorial Hospital. We'll now have an update from Public Health. Dr. Charles Ruiz is the Director of the Southwest Georgia District of Public Health. Dr. Ruiz.
Good morning. I have a little bit of show and tell. Empty bottle, but this morning when the sun came up, this was a full bottle of Moderna COVID-19 vaccine. Since the sun has come up, 10 people have received doses of vaccine out of this bottle. None of them had any immediate severe reaction. It's likely that the medicine that was in this bottle prevented COVID infections for some of those patients. It's even possible that the medicine in this bottle saved one or more of those lives. We really have a wonderful tool at our disposal, one that a year ago we could only dream of. It's here, it's readily available, there's no out-of-pocket cost, and we really want you to consider getting your vaccine the very moment that you are eligible for it. I have some slides that I want to share. We'd like to ask you to consider good reasons to control of the virus, there's a dramatic economic effect that it has on a lot of people. A lot of people have lost their jobs because of the virus. The court system, we've just heard the judge talk about how the virus has affected the court system and the faith community. We could go on and on. There are more reasons, but please consider, if you're one of those who is not yet willing to follow the recommendations and get the vaccine, please give it a second thought. There's no shame in changing your mind, especially if you're changing it for a better course of action. We've talked some already this morning about the eligibility. If you're able to see the information on the screen now, this depicts the current categories of eligibility. And this will change starting Monday. In the Southwest Georgia Public Health District, we are already taking appointments for those who will come into the new eligibility category on Monday. So you can't get your vaccine today if you're coming in on Monday, but you can call today and make an appointment. So the new category, I think Dr. Hudson talked about this, and maybe others too. So starting Monday, if you're 55 and over, you'll be eligible. If you have disabilities, you'll be eligible. If you're 16 and older and have certain medical conditions, and there's some examples here, common conditions like asthma, high blood pressure, heart disease, diabetes, sickle cell disease, you will be eligible. I do want to comment on the age group where we talk about being 16 years and older. That is only applicable to the Pfizer vaccine at this time. Public Health does not have the Pfizer product currently in Southwest Georgia. It is available through Phoebe and some others. Studies are being done on the Moderna product, and in time it may be that the Moderna will be opened up for people under 18. Currently that's not true. It's easy to schedule yourself for a COVID vaccine if you're eligible. In Southwest Georgia, we have a hotline or a call center that's open Monday through Friday from 8 a.m. to 4 p.m. That number is 229-352-6567. One word I want to mention about testing. Testing is still going on here in Dougherty County at the Exchange Club Fairgrounds. That's being performed by an organization called MACO. And in recent weeks, the demand for testing has really subsided quite a bit. On one hand, that's a good thing because it's probably due to the fact that the presence of the disease has been diminished a great deal in the community. On the other hand, it's too soon to stop testing. People who have symptoms consistent with COVID should still be tested, and that includes common things like a runny nose, headache, cough, nasal congestion, diarrhea, loss of smell and taste, sore throat if I haven't mentioned it. People with those kind of symptoms need to stay away from other people and need to be tested. That can be done 5 days a week at the Exchange Club Fairgrounds. Actually, this week it can still be done 6 days a week, but tomorrow is the last day that it will be done on Saturday, and it's because the volume has slowed down to a trickle. But still, Monday through Friday, you can get tested for COVID with a PCR test at no cost to you. We can have lots of hope, lots more than we did a year ago, if we will use these vaccines when we're eligible, if we'll wear a mask at appropriate times, practice social distancing, stay home and get tested when we're sick, keep our hands clean. There's a good chance that in the coming months we will be in control of this virus and life will get closer and closer to normal before we know it. Thank you very much.
Thank you, Dr. Ruiz, for your update today. Coroner Michael Fowler could not be here today. However, we do have Administrative Assistant Joy Carpenter, who will provide the coroner's update. Ms. Carpenter.
Good morning, everyone. I am presenting on behalf of Coroner Michael Fowler, and today I will discuss the number of COVID-19 deaths in Dougherty County. As of March 12th, 2021, there have been 275 reported COVID-19 deaths. There have been 4 new COVID-19 deaths reported since the previous press conference that was scheduled on February 26, 2021. In regard to gender, there have been 131 males to pass from COVID-19 and 144 females to pass from COVID-19. In regard to race and ethnicity, there have been 205 Black individuals to pass from COVID-19. There have been 63 white individuals to pass from COVID-19, 4 Latinos, and 3 Asians. In regard to race and gender, there have been 106 Black females to pass from COVID-19, 99 Black males to pass from COVID-19, 28 white males to pass from COVID-19, 35 white females to pass from COVID-19, 2 Latino males, 2 Latina females, 2 Asian females, and 1 Asian male. In regard to death by age, there have been 2 individuals to pass in their 20s, 5 to pass in their 30s, 15 to pass in their 40s, 21 to pass in their 50s, 78 to pass in their 60s, 63 to pass in their 70s, 62 to pass in their 80s, 26 in their 90s, and 3 in the 100s. We're going to talk about deaths per month, but we're just going to zero in for January 2021 through March 2021. For the month of January, there have been 41 deaths. The month of February, there have been 17 deaths. In the month of March, only 3. And Mr. Fowler would like to continue to encourage the community to consider receiving the COVID vaccine. Thank you all for your time, and you guys have a good one.
Ms. Carpenter, thank you for being with us today and providing our coroner's update. We'll now pause to open the floor for questions at this time. Please.
Just for the record, Jamie, WALB. I was wondering if someone is below the 55 age group but qualify for one of those other health conditions, do they need to provide some type of documentation when they come to receive their vaccine or set the appointment?
Okay.
Yes, Dr. Ruiz.
I'm going to ask Dr. Ruiz to come back up, and I'll repeat the question. Those who are over 55, would they be required to provide documentation as to
If they're under 55 and they have a health condition.
okay, under 55 with a health condition, are they required to have any paperwork documenting that? Dr. Ruiz, hang on just a moment. I want to get you behind the mic here so you can be heard. Okay, Dr. Ruiz.
I can really only answer the question from the viewpoint of public health. Other providers that administer the vaccine might have a different policy. In public health in Southwest Georgia, we require no validation, no proof It's the honor system, and so if a person calls and tells us that they have one of those conditions, we will honor that, and they will be considered eligible.
Dr. Lewis, additional questions, please. Okay. We'd ask you to join us here for our next press briefing, which we're now doing every other week. So we will return to this podium for this update on March 26th at 10 a.m., and we ask that you join us then. That concludes our press conference.